Hi, I'm Alex Tersey with the UVM Medical Center and the University of Vermont Health Network. Dealing with coronavirus on an ongoing basis can be difficult enough. Factor in being at home with children for the rest of the school year, and the challenges certainly multiply. At the UVM Children's Hospital, we want you to know that we're here for you during this time. We're here today with three pediatricians, Dr. Lewis First, who's Chief of Pediatrics at our UVM Children's Hospital, Dr. Keith Robinson, who's a pediatric pulmonologist and the Vice Chair of Population Health, Quality, Improvement, and Safety at the UVM Children's Hospital, and Dr. Benjamin Lee, who's a pediatric infectious disease physician at the UVM Children's Hospital, as well as a researcher at the UVM Vaccine Testing Center. They're all here to answer your questions about your child's health, your children's health. So please leave a comment, leave a question. We'll be here on the air to answer them. If you do have a question, leave it as a comment and we'll do our best to answer them as soon as they come in. Rest assured, though, that we will answer everyone's question, whether on air or after the fact. And without much further ado, we'll hop into the conversation. So welcome, Dr. First, Dr. Robinson, and Dr. Lee. Good morning.
Good morning, Alex.
Morning.
Thanks
Good
for
morning.
having us.
Yeah. So let's just start with a lay of the land. Dr. Lee, what do we know about COVID-19 in children at this point?
Thanks. Good morning. Thanks for having us. So what we know about COVID-19 in children is that infection in children does appear to be much less common than infection in adults. And when children do get infected, those cases tend to be very mild. There have been a number of large studies that have looked to try to see what proportion of COVID-19 cases occur in children. And by and large, these studies find that it's a very, very small percentage of cases, oftentimes less than 1% or less than 5% of all cases will occur in children less than 18 years of age. Now, that does not mean that children can't develop more severe illness. So we still need to be vigilant in terms of making sure we're protecting our children and protecting all of our community members. And the best way to do that for children is the same as for everybody else, and that's with good physical distancing.
And is there any different information about how children can spread it, even if they're not showing symptoms or have it or expressing it? What do we know about that?
Yep, this is a very, it's a great question. And so all the evidence that we have so far suggests that children are more likely to catch this infection from an infected parent or an infected adult, rather than children spreading it to each other or to other people. Now, with that having been said, if a child is infected, even if they're less efficient at spreading the infection to others, that doesn't mean that they're not capable of spreading it. And this is an area that's going to be receiving much more attention going forward, particularly as schools consider reopening. There are a number of schools, for example, in other countries that are starting to reopen, say in Europe. And this will be a very important topic to keep an eye on going forward, to see if children are capable of spreading this disease more efficiently than is currently believed.
Thank you for sharing that. We have a question from Amy. Thanks, Amy. She asked, are there any ideas as to why children are more resistant to this?
That's a great question, and there are a number of theories that have been proposed. Right now, we really don't have a general consensus. Some of the ideas that have been discussed is that it could be that the signs of illness are more related to a person's immune response to the virus itself, and that children are exhibiting weaker immune responses to this virus, and therefore that's maybe why they're showing such mild symptoms if they get it. There's some thought that the receptor within the lung that the virus needs in order to attach to the lungs and cause an infection may not be as abundant in children. Therefore, that might lead to some a difference in how well or efficiently children can get infected. So there are a number of different theories out there, but I would say there's no general consensus right now on why children seem to be relatively spared.
Could it also be that children may have had the virus and not realized it and now have antibodies to it, so that they may be appearing resistant when they've actually experienced it? I'm asking Dr. Lee.
So that's possible. Again, the question would come back to then why did they not have severe symptoms the first time? And so, and you know, why children have such mild course, even if they do get it, it's still a bit of a mystery.
Dr. Robinson, anything to add to that?
No, I think there's a lot of work going on nationally and internationally about trying to answer all those questions through research. So there's a lot that we don't know at this point. So, you know, staying connected from a scientific community is going to be key.
Are there any promising studies being done right now that we should watch, or?
Let me take that. First of all,
Okay.
it's important to recognize that there are now some new symptoms that the Centers for Disease Control and Infection have put forward that may apply to children as well as adults. And again, we've talked about lack of smell, lack of taste, fatigue, some gastrointestinal symptoms. So this is really, we're trying to understand that. So when you say, are there some studies that are going on? The answer is, one of the things I do is edit the National Journal Pediatrics for the American Academy of Pediatrics. And we have been inundated with hundreds of manuscripts or studies that people would like to have us publish. And just like what you're hearing in the mainstream news, some of these have, you know, are stories of one child, which really doesn't allow us to really bring to a conclusion, and we don't know necessarily why a medicine or a treatment worked or didn't work. And others are large groupings of children, such as in large urban areas, where we are learning about patterns of how they present and how they are treated and what happens to them in intensive care units or in the primary care office. So the good news is that we are taking all of these studies and getting them out to the mainstream news and to social media as soon as we publish them. But at the present time, what Dr. Lee shared in regard to the mild symptoms and trying to understand the immune system are where we are. We obviously are as excited about the possibility of vaccines for this virus and medications once children and adults get this virus as we are with adults. But we're just going to have to watch and let this adventure continue.
Great, thank you. We did have a question from Emily. She was wondering, how do I properly mask a toddler? What age can wear masks? Where is it okay to be outside and play with the child and not wear masks? So when it comes to physical distancing and masks, any best practices that parents can follow, and are there certain parameters around the age of the child?
I'll start, but again, Dr. Lee, Dr. Robinson can chime in. There has been recent information that's come forward from the Centers for Disease Control, and again, many have perhaps heard on the news, that masks are not being recommended for children under the age of 2. And the reason for that is you want those masks to be close to your face. And if a child goes to sleep and has a mask close to their mouth, where they may, if it's a baby, really not be able to protect their mouth from the closing of that fabric on the mouth, there's a risk that they could stop breathing. We don't want anything like that to occur. So the recommendations are, if you're taking your infant or outside in a carriage, to put a light blanket over the top of the carriage that, again, does something to put a fabric between their face and the atmosphere and what's out there. Remember, masks are really there to protect others from getting what you may be breathing out, but something is better than nothing. And it's now recommended that in public over the age of 2, children should be wearing masks. Even if they're with family and they have been saying we're in close, these are our trusted people that we don't need to wear masks in the home. When you're out on a bike path or walking through town, you're going to pass other people. Sure. And when you do that, a mask is really what I would recommend, what we would recommend. Dr. Lee, do you want to add anything?
No, I think that pretty much sums it up nicely. I think, you know, the general rule of thumb is if you're going to be anywhere where it's reasonable to suppose that you're going to be coming into contact with any other person, then a mask should always be worn.
Okay. 2 quick questions from Sadie and Bonnie, who are watching. Thanks for watching, and you're welcome. We were very happy to organize this. Sadie wants to know, should she take any extra precautions with a newborn beyond what you said, Dr. First?
I know that Dr. Robinson has been working very hard with our mother baby team. So also, why don't we start with Dr. That's the beauty of all of us. We can just toss this around.
That'd be great.
We're going to try and get you your questions. So Dr. Robinson, why don't you start on this one in regard to what we're doing with babies, and then we can all chime in.
Sure. So our labor and delivery team, our newborn nursery team, and our neonatal intensive care unit have worked really, really closely over the last several months to develop really kind of comprehensive plans to promote health and well-being for the family. It's not just about the baby; it's about baby and the entire family. And so when moms have COVID or a parent has COVID, there is a recommendation from the American Academy of Pediatrics to separate for a period of time to reduce the risk of transmission to babies. We think the risk is low, but we don't actually know what that is. So we want to take reasonable precautions to make sure that the risk to the baby is decreased. And so that's one recommendation that is made from the American Academy of Pediatrics. At the same time, we're at the Children's Hospital, we're still trying to promote visitation of the family to the baby in the newborn nursery. So our teams are working really, really hard on this. We actually met at 7 o'clock this morning. I just came from that meeting. So our teams are doing a great job on that. And Dr. Lee's part of that team as well. And I don't know if you want to comment too about the recommendations about newborns.
Yeah, I think for newborns, the recommendations that I would suggest are similar to what I would say in other instances as well. Is if anybody has symptoms of illness, then it's reasonable to keep that person far away from the newborn, and to make sure everybody within the household is practicing very strict hand hygiene, respiratory etiquette, those basic everyday things that can help reduce the risk of transmitting any type of infection to a newborn. As Dr. Robinson mentioned, it becomes a little bit more complicated if there's somebody who's positive for COVID-19 in the household. But the safest rule to follow is that if there's somebody with COVID in the household, if at all possible, that person should be kept away from the newborn or infant, and if possible, a healthy caregiver be identified who can pitch in and help provide the care.
I would just add that I really want the take-home message to be that, again, we're doing really, really well in this region. And the goal is to bring mothers and babies together, and fathers together, and parents together, so that, again, in the home, if someone is not symptomatic, and even, we want mothers to bring their babies to them, skin to skin. Breastfeeding is best. This is not one to say, oh my gosh, I sneezed. Am I going to give this to my baby? Again, the best thing you can do is stay in touch with your healthcare professional. But I think the overall goal is there is so much to be gained in those initial days between a family and a newborn baby, and a mother and a baby, and a father and a baby, to bring them all together, that being in a pandemic doesn't mean you can't hug your newborn infant or your child who is isolated with you in that home while we're crushing that curve, but also having an incredible time while we're isolated, to have a very special relationship with all members of the family. Nobody wants to say anything good about a pandemic, believe me. But the one thing that one could say is, rather than look at being home as a punishment, this is an incredible opportunity to have quality time with your children, your infants, your babies, your teenagers, in ways that you will never have the opportunity to do again. And so cherish that and look at the positive, and not just think about all of the negatives that have been associated with this horrible, horrible virus and what it has done to really transform the world.
Well said. Thank you. We're here with Dr. Lewis First, Chief of Pediatrics at the UVM Children's Hospital, Dr. Keith Robinson, a pediatric pulmonologist, and Vice Chair of Population Health, Quality, Improvement, and Safety at the UVM Children's Hospital, and Dr. Benjamin Lee, a pediatric infectious disease physician with the Children's Hospital, as well as a researcher with the UVM Vaccine Testing Center. All here to answer your questions about COVID-19, what's going on in the world right now. So please post a question if you have one. We'll have our experts answer them live on the air or after the fact. So we did have 2 questions come in. One is from Bonnie. She's curious. She's a grandmother with 2 grandchildren under 7. She's healthy and she would like to see them. And she's really wondering, what's the risk? I'm sure she's missing them. So any feedback on that?
I'm happy to start, but I would turn to my colleagues. We have really made amazing strides with what we call mitigation, which is reducing the opportunities for this virus to spread. We know that adults are not handling this. Some do very well, but some do not. And the sooner we can crush this curve, and the governor, as he says, turns the faucet a quarter of a turn at a time, the more we're going to be able to see the people we love and care for so much. I can't come forward and say right now, if you are not in the inner circle of a family as a grandparent, you are through things like televideo and video chats. And I would savor those and build those in each and every day. You can wave, you see a lot of grandchildren coming to see their grandparents and waving in the window. But remember, if we start to get lazy here, we don't want to have any grandparent, adult, child succumb to this virus that they don't need to until we know we have conquered it. So for the moment, be patient. We're starting to loosen some things up. I would suspect that you will be able to see your grandchild in person sooner than you expect because of the great work we've done in this state and upstate New York. But for the moment, I can't sit here and say, what's the harm? The harm is that you don't know who's going to get this virus and not deal with it well. And you certainly don't want the trigger to be somebody you love or that loves you or that gives it to other people who are around you. So for the moment, here's to physical distancing and televideo. Dr. Lee, do you want to add to that?
No, I think that that was well said. I think, I know these are very challenging and difficult decisions. Just last night within my family, we were having discussions about how our children are missing their grandparents. And so we know that, a warm hug is really, there's no substitute for it. But unfortunately, at this time, the risks being what they are, I do think that ongoing physical distancing is still at this time necessary and crucial. And so I think all of us as a society are trying to come to figure out sort of what the best ways to be in close touch with those we love are. And definitely, as this interview format suggests, televideo, FaceTime, et cetera, can't quite substitute for a warm hug, but I do think for now, that's probably the most prudent thing.
I would say this goes across not just for grandparents. My children and my granddaughter are here in the Burlington area, and can't hug them. But we can do family dinners through televideo, FaceTime, etc., and we can see each other and laugh and talk about our day and still give virtual hugs. And I hope people will do that and not just assume you can't have that time with family. Because the conversation is as much, and the hug is there. I don't even like the term social distancing because we are being so social. It's really physical distancing, as Dr. Lee and Dr. Robinson have referred to, because we have to be social right now, more so than perhaps we even were before the pandemic.
As a follow-up to that, Christina asks, is it safe for a family member who's recovered from COVID-19 to return to the home and be around young children? Are they potentially contagious after they no longer test positive?
Dr. Lee, Dr. Robinson, you want to take that one?
So that's a great question. Now, there are clear guidelines from the CDC for patients who do test positive. At what point can they be considered to no longer be infectious, and at what point can they go about sort of their typical routine? So generally, that means a minimum amount of time has to have elapsed from the onset of symptoms. Right now, it used to be 7 days. I believe recently this has just been increased to 10 days from the first onset of symptoms, and at least 3 days with significant improvement in symptoms, including not having had fever for at least 3 days without use of any fever-reducing drugs or medicines. So that's the general guideline from the CDC regarding patients who have had it and then are now getting better. In some scenarios, repeat testing to show if somebody is negative is recommended, but by and large, for otherwise generally healthy people in the community, we actually do discourage repeat testing to prove that the virus is gone, because the non-test-based strategy using symptoms and time has shown to be working pretty well.
Okay. We had a few questions about testing, so I'm just going to read a few of them and let the panel jump in. First question was around where are we with testing for asymptomatic children? Is it important to know a child's status to protect those around them, or is the recommendation just to keep them home isolated while symptomatic? Another question from Megan. She has an at-risk child who's a patient at the Children's Specialty Center, and she's wondering if there's any antibody testing for children when they come into the clinic, et cetera. So maybe just a quick discussion on testing to just respond to those questions.
I'll lead into this and give it to Dr. Robinson because this is his thing and he takes care of many complex kids. But I think what everyone needs to understand is yesterday the governor made a very key comment, which was to begin to open up the health system again, to see children. We've been talking a lot about COVID-19, but children have not had appointments with their healthcare professional for weeks, months now, who have underlying medical conditions. And so people are scared. People are afraid to say, should I come back? I don't know, would I get that virus? Again, we've already talked about how low the prevalence is right now because of the great work we've done. But that doesn't mean we take our foot off the pedal. And Dr. Robinson has been spearheading efforts across the state, wherever your pediatrician, family physician happens to be, nurse practitioner, physician assistant, to make sure this care, when you bring your child to us or we see you, is safe, effective. Well, I don't want to steal your thunder. Dr. Robinson, why don't you talk about the whole issue of where the testing fits in, but why we have to make sure when you come to see us, it's actually less risk than if you stay home with your child with medical problems and we don't get to see you. So, Dr. Robinson, it's yours.
Thank you. All right. So in the Children's Specialty Center, we have a team of doctors and nurses and other healthcare professionals that are working very hard to make sure that when we see children with complex medical issues, that it's done in a safe way. And we've actually got tools that we use to make sure that we can actually do this in a safe way. And so I'm just going to share something real quick with everybody. So this is a high-level map of what we're doing here. So the Institute of Medicine has a framework that they want all healthcare providers to follow when they're delivering care. And we've done this for years. So they want care to be safe, timely, efficient, effective, equitable, meaning that everybody receives the same care, and then patient-centered. In our case, in Children's Hospital, it's family-centered. And so part of what we're trying to do, the actual implementing this, is making sure that when people come to the Children's Specialty Center, that we're giving them, that we're safe, that we are testing people that are symptomatic or at risk, but then that we're also making sure that the workflows that we have when people come into clinic are safe, and so that we're reducing exposure. So this is another map of how we're actually going through screening people, taking care of people, and then making sure that if somebody is symptomatic, that we actually can get them a test right away and get the result right away.
So you raised the point, Dr. Robinson, about symptomatic versus asymptomatic on the
right.
what we're doing. So you may want to highlight.
So this is mainly geared towards. I want to talk real quick about the Children's Specialty Center and children that are symptomatic. So if kids are symptomatic, we want to make sure that those children we can identify them, see them in clinic if we need to, and then make sure that they have a test. For kids that are asymptomatic, there are strategies to test children that are not symptomatic. Over the last several weeks, we've really focused on kids that are symptomatic, and more importantly, symptomatic and fairly ill. The testing strategy, or maybe over the next couple of weeks to months, might target or at least be geared towards children who are really asymptomatic, as we're trying to learn more about where coronavirus is, who has it, and who's being most impacted. And Dr. Lee and I are actually working on a larger committee to figure out our testing strategy here in the Children's Hospital. So I guess I just want to make everybody rest assured that in the Children's Specialty Center, we have a strategy to make sure that kids that have symptoms are cared for properly and more in a patient and family-centered way, that we can offer people the test. But then for the asymptomatic piece, I'm going to kick that over to Dr. Lee so he can pick it up from there. Is that okay?
Yeah, so thanks, Keith. Right now in the state of Vermont, we are recommending testing in children who are symptomatic, and no matter how severe their symptoms are. So even if symptoms are mild, that child is eligible for a test. This is different now than it was maybe a month ago when there were greater concerns about testing capacity, et cetera. But here in the state of Vermont, we're in a really good spot in terms of our capacity for testing. And so any symptomatic child is eligible to get a test. As Dr. Robinson mentioned, moving forward, there may be certain specific populations of patients in whom tests may be recommended if they're asymptomatic. In the pediatric population, this might, for example, involve patients who need to come in for a surgery or a procedure and that sort of thing. Those details are still in process, but more information should be forthcoming on that front. But for now, anybody who has a symptomatic child, that child can get a test through their doctor.
I was going to say that the other point would be that if an adult is COVID positive, the new, detect and then do tracing and contacts, children who are around that adult will get tested in terms of trying to contain who particularly might have the virus. But I want to go back to what Dr. Robinson said too. If your child, again, we've missed seeing your children across the state and region. It could be because of vaccines. It could be because we want to see height and weight. We want to see developmental progress, or we want to see the illnesses that you're concerned about, whether it's a headache, belly pain, etc., and even school sleep issues. And so you need to be aware that step one is to call us. We now have televideo, and it's transformational. We can learn a lot and spend time with you through televideo. You can call us on the telephone, and you can come see us. And when you come see us, it will be different in a good way because we want it safe. So we'll tell you when to come in. The waiting rooms will not be filled. There will be physical distancing. Everybody will be wearing masks. All of the steps that can reassure you. But the bottom line is your children are that is our focus. And to not see your children and not make sure that they are growing and thriving because everybody's afraid of COVID, that is not what we want to see happen. There are so many ways now to access us, and the time has come to please call your healthcare, your medical home, even as an adult, and check in. We have been working hard to get to the people, not who are COVID positive, but to all your children during this time, and just check in with you to say, are you okay? And what can we do to help? But now we can see you. But please be reassured by what Dr. Robinson showed you, how safe and all the steps we are taking to make sure when you come, not only are we talking the talk, but we are walking the walk. And we want our children in this community healthy long after this pandemic has disappeared. So let's not slip here, miss on vaccines, miss on the things that will ensure good health as we move through the summer and into the next school year. Mm. I know I sound preachy, but this is really important that we don't lose track of our kids because we're all scared to access healthcare. We're making this as accessible and as welcoming as we possibly can, but we need you to be part of the solution.
I think it's critically important, and I hope that our community knows we're here for you. We want to talk to you. We want to talk to you about your children's health. So we're just a phone call, a Zoom meeting, et cetera away. Please contact us. We're here with 3 of our pediatricians from the UVM Children's Hospital. Dr. Lewis First is our Chief of Pediatrics. Dr. Keith Robinson is a pediatric pulmonologist and Vice Chair of Population Health, Quality Improvement, and Safety, lots of things, at the Children's Hospital. And Dr. Benjamin Lee is a pediatric infectious disease physician with the Children's Hospital, as well as with the UVM Vaccine Testing Center. We have a few minutes left, so I'm going to try to get to a few more questions. Please feel free to post your questions. If we don't answer them on the air right now, we will certainly work with our panel of pediatricians here to get you the answers after the fact. So don't be shy. Dr. First, you talked a little bit about going into the spring and summer, and there are a few questions here from people around. Amanda asking, her child is starting school in the fall. Should she take extra precautions? Kelly is wondering, she has a 14-month-old. Who will be returning to daycare when she returns to work soon. She's concerned about the fact that she wouldn't be wearing a mask. What can she do to protect her? So as we go into the spring and summer, how can we protect children, keep them safe and healthy, and move forward?
Well, I think we're on the cusp. First of all, the most important thing is to use data and science and evidence and not high emotion to drive how we're going to do this. We're learning from, hopefully there will be wonderful examples, and nobody wants to see children get sick, but I would suspect that when schools restart, classrooms, there'll be physical distancing still. There may not be large assemblies for a while until we have the vaccine that's going to eradicate this virus. But that mean kids can't come back to school? No, they can, is what we hope. but we're trying to establish the same guidelines we do for our offices for more public settings. How big a classroom size can you have? What needs to be done when you're exercising out in the playground? Are masks needing to be worn by school-age kids, but they can still run? Exercise is really important. I know that the Centers for Disease Control and Prevention are going to release guidelines very, very soon on summer activities. So rather than I sit here and tell you what to do, we need to look at the evidence and have those guidelines in place. And everybody knows the summer is coming. So, you know, the country, it's not just about, I'd like to say it's about Vermont and upstate New York, but we really need to show what we're doing here is also exemplary for the rest of the country. But let's use some data to make things that are not going to be overly cautious, but at the other time, too liberal, that will result in us having to get everybody socially isolated, physically isolated again. Dr. Lee, do you want to comment on what would be some instructions at this point from an infectious disease standpoint going into the summer for families so they can still have fun, but still appreciate what we're going through?
Yeah, I think that, I guess the one point that I would like to try to emphasize for families with children is, you know, it's almost never too early to try to reinforce good habits in our children. So teaching them how to do respiratory etiquette, you know, covering their nose and mouth with their elbow when they cough or sneeze, knowing how to wash their hands well and when to do that. You know, again, a lot of the strategies that will be most successful are really the more mundane ones, such as this. And so, you know, I know it can be challenging. We, you know, in my family, we deal with this every day. But promoting those good habits, teaching them the importance of physical distancing, and modeling all of these behaviors as well. Once camps or schools do start to reopen, again, I think one point that I would like to emphasize is that, you know, we're all in this together. So one of the most important things that we can do is if a child is having any type of symptoms at all of illness, then please keep that child home. The last thing we want is to be sending lots of children, sick children, you know, into school or daycare. So that is something that is very important that we as individual families can do to make sure we're protecting those around us as well.
So I think we will see a lot more masks, but again, for parents, the most important thing you can do is ask questions, you know, if you can't get the answer, ask your healthcare professional, go to the Vermont Department of Health websites, put in your questions, or look at the Centers for Disease Control. The American Academy of Pediatrics has a website, healthychildren.org is the website for the American Academy of Pediatrics. And there's some wonderful, wonderful pieces of information there that will help you figure out the activities for your child. Most of all, I'm going to recommend, please, everybody take a breath and stay calm, because if you start to feel stressed about what are we going to do this summer, your kids are going to read that and they're going to get stressed as well. Kids right now want to have predictability in their lives. They need scheduling, flexibility, and creativity, and they like to have some control. So as Dr. Lee just pointed out, telling them they can be part of the solution, they can be superheroes by showing other people how to sneeze properly and, you know, how to do good hand washing, suddenly makes them heroes when they can point out to others the right way to help save lives by what we're preaching. And that in itself makes kids feel better about the situation rather than have it told to them, you must wash your hands. They need to understand they can literally save a life by taking these preventive steps. And that makes them feel valued and makes families all take that cleansing breath and enjoy this time together.
I love that idea. What a wonderful idea. Little heroes. Well, thank you. That's all the time we have for today. If we didn't get to your question, please be patient. We'll work with the pediatricians to get your question answered. Doctors, thank you for your time. Any final message you want to share with the community before we sign off?
I'll just basically say, working together. First of all, savor this time with your children. Okay, even though this has been challenging, this has been difficult, but stay calm. Relish the relationships we have, which are very, very special. And you'll think about that long after the pandemic is gone, that we've done this and we've conquered it together. And I thank you, Alex, for allowing us the opportunity to field these questions. We will continue to do this until we get rid of this virus, and we'll do it for many other things. We didn't even talk about summer illnesses, but that could be a whole nother Facebook Live to talk about all the other things non-COVID that we want to think about as your kids get out there this summer.
Wonderful. Well, remember, at the UVM Children's Hospital, we're here for you. We're open. We're ready to talk to you and see you, and whatever manifestation that is. So call your doctor, call your healthcare providers about how to best continue your care during this time. For more information and updates about COVID-19 and your healthcare, please visit uvmhealth.org/coronavirus. Again, that's uvmhealth.org/coronavirus. And we'll see you again. And we will certainly, let's do this again.
Absolutely.
Be well, everyone. Talk soon.
Take care.
Bye.
Thank you.